Hello, I'm Tiffany and welcome to the Raw Report. There are areas in California that continue to be overwhelmed by COVID-19, even as the state as a whole continue to see some of the lowest case rates in the United States. The Guardian reported Wednesday about the shocking scene at the Community Regional Medical Center in Central Valley, where patients are lined up outside on ambulance gurneys because there are no hospital beds available, said Dr. Kenny Banh. At Roseville Medical Center in Northern California, an ER nurse described it as being like the line at Disneyland, with people stretched outside and around the corner waiting to sign into the check-in desk. Quote, "I'm exhausted and just disappointed that we're here," said Banh, who also teaches emergency medicine at UCSF Fresno. He's been taking extra shifts in the ER and ICU while also managing vaccine clinics and testing centers. He explained that all of it, quote, was preventable, but there are still people who refuse to believe they have COVID-19 or even that it's real, even after they are on ventilators. COVID doesn't necessarily need one to believe in it to kill them, unfortunately. The overwhelming majority of people dying are either unvaccinated or immunocompromised, he said. In Tehama County, for example, they're suffering from the top infections in the entire pandemic, with cases surging much higher. It was just weeks ago in mid-September that Fresno hospitals revealed that they'd have to start rationing care. Fresno County's interim health officer stated, "The largest hospital systems that we have here in the county are telling us that they are over 100% of their normal capacity, and some of them are as high as 140%, which is really pushing the surge standards and really almost tipping us into what we call the crisis standards of care." The California recall came largely from those opposing Governor Gavin Newsom's lockdowns, mask mandates, and other COVID precautions. Some analysts think that the Delta variant killing so many people turned miffed voters into believers. But after the election, a map circulated showing the striking comparison between COVID-19 hotspots and those who supported the recall. Ambulances have started rationing rides to hospitals, the report explained. They can only pick up patients who meet a certain criteria. Quote, "We've never had anything like that before," said Dr. Danielle Campaign, who directs the medical side of American Ambulance in Fresno County. When stay-at-home orders were lifted, people went back to their everyday lives. She explained that there was an influx of patients during the early days of COVID surge, but because people were staying home, there weren't car accidents or shootings to compete for ER beds. To add to the problem, they're losing doctors, nurses, respiratory therapists, and administrative coordinators, the Guardian said. Nurses are working overtime to make up for the colleagues who contracted COVID and have to quarantine. Quote, "We're experiencing burnout and also moral distress because when we don't have the resources and staff we need, patients aren't getting the care they need," said Kaiser Hospital nurse Rachel Spray in Fresno. Thank you so much for watching. To check out the full story, please visit rawstory.com. And if you'd like to see more of the Raw Report, be sure to like and subscribe and join others who like their news raw too.